Hi everyone, welcome to week 7. This week we are looking at chapter 9 in your textbook. This chapter covers the musculoskeletal drugs. So these are the drugs that are going to be used with the muscular and skeletal systems. So what you're going to be looking at are some specific conditions and disease states and those drugs that are used to treat them. The most common ones that we're going to be looking at in this week's material is osteoporosis, osteoarthritis, rheumatoid arthritis, and gout, and then things like strains, sprains, things like that. So as you go through here, you're going to want to familiarize yourself with the skeletal system. So if you don't remember everything you learned about it before, you'll want to go back and just kind of familiarize yourself with where the different parts are and how they're affected and things like that. So as we start looking at the different drugs, we're going to first look at the osteoporosis. Osteoporosis is all about the actual bones deteriorating. So when we're looking at maintaining healthy bones, that's what we're talking about. So when we're talking about drugs used to treat osteoporosis, we are looking at maintaining that healthy bone. So these are some of the things that we do normally to maintain healthy bone. Controlling the amount of calcium that's in the body, hormonal balance, diet, and exercise. So when we have someone who is being treated for osteoporosis, what we typically think of is that thinning of the bone. Here's just some of the different risk factors that are affected. You're going to find that most, that it's more common in certain folks. So more common in the Caucasian race and the Asian race, more common in smokers, more common in those people who don't exercise, more common in post-menopausal women. So we want to look at some of the things that we can use to prevent and some of the things that we can use to treat those people who are suffering or who may be at risk for osteoporosis. So these are some of the drugs that are going to decrease the rate at which the bone is broken down. Fosamax is probably one that you may have heard of fairly often. It's actually advertised on TV quite a bit. And Boniva is actually one that has been promoted, I guess you could say, by Sally Fields. So she has osteoporosis, and so they're like spokesperson for that one. So some of these may be a little more familiar to you than others, but that's what this particular category of drug is all about. So it helps to decrease the rate at which the bone is broken down or reabsorbed. Then we have some others that are used to prevent and treat. So it's similar in the fact that it's going to be hormonally based, estradiol. So Avista is one of the drugs that's used for that. So estradiol is actually a female hormone that's secreted by the ovaries. So it actually is something that we normally produce in our body. So that's why it's used in treating the osteoporosis types of conditions. There's a few others, as like we said, Avista, but then we also have estrace, Premarins, those types of drugs that are also used. There's other hormonal types of drugs used for osteoporosis, and here's just a couple of them. And then we also have calcium supplements that are used for osteoporosis. So making sure that we have that vitamin D addition as well. And then we have the combination drugs. So Actonel with calcium, Fosamax with calcium. So those are some things that are used in combination. So they're used together. Then the chapter goes on to talk about osteoarthritis. So this is more of a degenerative disease. So this is our hips and knees typically are affected by these osteoarthritis. You're going to see drugs that will help with the pain and inflammation, also with the swelling. So some of the over-the-counter things that we use for osteoarthritis are basic things like aspirin. So Bayer, those kinds of things. You're going to see some over-the-counter medications, but then you're also going to see some of the more long-term medications that are used too. Then we're going to get into talking about non-steroidal anti-inflammatories. So there's less upset stomach with those. Here's a good list of all of the categories. So you're seeing both prescription and non-prescription for the osteoarthritis. You're going to then be looking at the drugs that are used to treat, where was it? Sorry about that, guys. Lost my train of thought. Rheumatoid arthritis. So rheumatoid arthritis is a little bit different. It's an actual autoimmune reaction. So your body's actually does it to itself almost. It's kind of a, it's got its own internal thing that's causing this. So again, we're going to treat it with some of the same drugs that we treat osteoarthritis, but there are some differences as well. So make sure you pay attention to those. And then last but not least, you're going to be looking at the drugs that are used to treat gout. Gout is a buildup of uric acid. And then there's going to be a few other things touched on: sprains, strains, some of the muscle relaxers used to treat those types of conditions. So if at any time over the next week you have any questions or problems with Chapter 9, please make sure you reach out to me. You can call, email, or text, and I'd be happy to help you. Have a great week.